Okay, today we're going to talk about common causes of fibromyalgia. We talked about fibromyalgia as a syndrome, trying to help you understand that the symptoms of fibromyalgia can actually be caused by a number of different underlying conditions. We also talked about multiple layers of dysfunction in the fibromyalgia patient. You were able to see that very clearly with Dorothy's example. Then we talked about peeling back those layers. So I want to give you an advanced view of what that looks like as we get deeper into this during our discovery stage, but I really think it's appropriate to give you an idea where we're headed. I'm going to switch over to our PowerPoint now. What you're looking at right now is what you might call the functional medicine iceberg. You'll notice that the diseases are what is above the surface of the water. They're easy to see. Diseases are simply the names that we give to a set of symptoms that a patient is experiencing. Ultimately, these symptoms are caused by underlying physiological deviations from normal. What this means is that your body is simply not performing the way it should in areas below the surface. Under the surface, we see different areas of physiological function. There are only so many things that can break down. The current medical model for chronic disease is to treat the symptoms that are most troubling for the patient with very little to no regard for the underlying cause of the symptoms. This is normally done through medication. Let me ask you a question. If you only treat the symptoms with no regard for the underlying cause, how long would you have to take the medication? The short answer is forever. Let me ask you another question. Who does that concept benefit the most? The patient or the pharmaceutical industry? If you said the pharmaceutical industry, you're exactly right. Now, to simplify that concept, think about a man standing on a thumbtack. Should we give that man pain medications, or should we pull the thumbtack out of his foot? The answer is no less obvious for the fibromyalgia patient. You have to look for the underlying cause of the symptoms in order to bring resolution to the syndrome. So, as a functional medicine practitioner, we look for inflammatory imbalances, immune system imbalances, gastrointestinal imbalances as it relates to digestion, absorption, and microbial imbalances, hormonal imbalances, detoxification imbalances, and so on. Now, let's turn our attention to the functional medicine approach to fibromyalgia using what I call the fibromyalgia iceberg. Also consider that the tip of the iceberg is always the smallest part. The part you can see and feel is the smallest part. Remember, you see and feel the symptoms. The actual disease name is simply what we have decided to call a set of symptoms. You'll notice that fibromyalgia syndrome is at the tip of the iceberg. It is made up of all the symptoms of fibromyalgia. Below the surface of the water, you'll notice the most common things that we see in a fibromyalgia patient from a clinical setting. We see gastrointestinal dysfunction, which could include yeast overgrowth, leaky gut syndrome, bacterial dysbiosis, pathogenic and opportunistic bacteria, parasites, digestive and absorptive dysfunction, autoimmune disease, depression, thyroid and adrenal dysfunction, small intestinal bacterial overgrowth, food sensitivities, systemic inflammation, and a host of other dysfunctions. These are the things that we commonly see in the fibromyalgia patient. However, each patient is separate, individual, and distinct. We determine these deviations from normal by walking you through a complete and thorough health history, evaluation of past medical records, lifestyle and travel history, family history, which looks at the genetic predispositions. We use a variety of assessment forms that give us insight into your physiology through observing the most prominent symptoms, and if necessary, we move on to advanced testing. Advanced testing is where we have the ability to look at your saliva, urine, blood, to clear up any confusion that might be left after all the other evaluation is complete. So consider this big concept. Let's use Dorothy for an example because you're familiar with her case. Dorothy was diagnosed with fibromyalgia. For the sake of this discussion, let's say that fibromyalgia was her major diagnosis. Underneath the fibromyalgia diagnosis was lupus, Raynaud's syndrome, irritable bowel syndrome, depression, yeast overgrowth, leaky gut syndrome, gluten sensitivity, adrenal fatigue, and parasites. Picture in your mind each of these underlying issues being a huge rock that Dorothy had to carry everywhere she went, to the grocery store, to work, to the bathroom, to bed. When her husband tried to hug her, she had to carry the rocks. When there was a family event, she had to carry the rocks. When everyone in her family wanted to go to the park, she had the rocks. No matter what was going on in her life, rocks were always on the top of her mind. She had to ask herself, can I do this while I carry the rocks? Well, carrying the rocks was absolutely exhausting, so she was always tired. As you can imagine, the rocks got in her way. Now, does that sound like you feel sometimes? This is a very simple and silly illustration. But I've noticed over the years that as we uncover and address the underlying causes of fibromyalgia, it's like pulling a rock out of the sack the fibromyalgia sufferer is carrying. The more rocks we pull out, the less our patients suffer, the better our patients feel, and their body is better able to do what it does best, which is heal itself. After our discovery stage, we started pulling these rocks out of Dorothy's sack, and life got a lot better for her. The pain and the symptoms got less severe, and her health improved, and she got her life back. I just described the process that we're using to help you overcome the symptoms of fibromyalgia syndrome. The reality is that the more we can do to lighten the load on your body's physiology, the better equipped your body will be to do what it does best, which is heal itself. Once discovery is complete, we develop the most appropriate treatment plan to address the underlying cause, not just the symptoms, for the fastest results in the least amount of time. And that is how we peel back the layers of dysfunction. With more than 12 years of treating fibromyalgia patients, all of them had some significant gastrointestinal issues. On the next video, I want to show you how the gastrointestinal system is like the hub of a wheel. It's got spokes that connect to every other physiological area of your body. I believe that you'll find this very enlightening and helpful as we move closer and closer to our discovery stage. Be well.